Okay, everyone, welcome to lesson 12, the very last lesson of this quarter. So in this lesson, we're going to be looking at aligning quality improvement with human resource management practices. Okay. So the importance of quality improvement and patient safety. First of all, okay, so the importance of quality improvement and patient safety affects, so patient safety and of course quality in the care is going to affect the patient care, the costs, the overall cost of the organization, the cost of the resources and the cost of the labor, the cost of the treatments, everything, as well as patient and employee satisfaction. So all of these are going to be the results or the outcomes of quality improvement and patient safety. So if we have terrible quality improvement, terrible patient safety, it's going to really affect the patient care, it's going to affect costs, and of course patient and employee satisfaction. And the way that it does is if you have terrible patient safety, then patient care is going to be awful. Okay, if you're not providing quality service to your patients, you could there could be medical error, there could be overuse, underuse, misuse of treatments and medicine and things like that, which can have dire costs on the patients, right? And in addition, that's going to drive up business costs in the organization. Okay, so if you're wasting a lot of the resources and you're causing a lot of medical error, when you cause medical error, you have to find ways to fix it, right? Okay, or there could be lawsuits, which is also going to be another way for your cost of the organization to go up, right? So you're going to waste a lot of money if you're not improving the quality and the patient safety. Of course, patient and employee satisfaction is very important because, of course, your employees are the backbone of your company. They're the ones providing the services. They're the ones providing care to your patients and whatnot. So they have to be satisfied with their jobs in order to do a really good job. And also, they need to participate in the quality improvement and patient safety. Secondly, patients. Quality improvement and patient safety, of course, is going to affect patient satisfaction, okay? And if patient satisfaction is very low, then they're not going to come to your facility. They're not going to get your medical services. They don't want your medical services. They're going to go somewhere else because they know that you're going to ruin things. You're going to screw things up for them, okay? If they're not satisfied with you, they're also going to tell their friends, and they're going to tell a lot of people not to go get services from you. Okay, so you're going to have to, this is why quality improvement in patient safety is very important. Also, your reputation and everything like that has to do with it. But anyway, so quality improvement and patient safety, it needs to be consistent with changes in the financing and delivery of care. Okay, such as paying your providers for quality, right? So if your providers, your physicians, your nurses and whatnot are providing great care, then you should pay them more, okay? They should earn a little bit more money if they're providing great care, if they're improving the quality of care, because of course that's going to go back again. You're going to save money with your institution. You're going to have greater patient care. You're going to better patient outcomes, better patient satisfaction, all because you're paying your providers well, and your providers are providing great quality. Okay, so also quality improvement and patient safety are universal importance in all healthcare organizations. All healthcare organizations have to participate in quality improvement and patient safety, regulations, and also just moving forward. You have to be working on that all the time. Otherwise, you're going to fall through the cracks, and you're going to have, again, medical error, high costs, terrible satisfaction. Okay. Okay, so there are twin pillars of quality improvement. So data measurement and employee engagement and participation. So what do these have to do with quality improvement? Okay, well, when you're trying to improve the quality of everything in your organization, patient safety, of the medicine that you provide, of all the services that you provide in your organization, you need what's so important to even improve the quality, to work on an quality improvement thing, to have that sort of like a campaign going on in your organization, it's so important to be collecting data and measuring everything that you do. You need to collect data because you need to figure out where you are, okay? Where are you right now? All right, and then as you take measures to improve the quality of everything in your organization, you have to be keeping track of all of that. Everything that you do has to be measurable, okay? And you're keeping track of those measurements so that you can look back and go, are we improving quality? Are we reaching our goals? Are we not? What do we have to do to, make these numbers better? Okay, so everything that you do has to be measurable, and you always have to be keeping track of that data, and that's so important, especially in quality improvement, but it's also important in almost every other aspect in running your business. Okay. Secondly, to improve the quality of care in your organization, you have to get your employees to engage and participate in every sort of quality improvement campaign that you are starting. Because your employees, like I said, your employees are the backbone of the organization. They do the work in the organization. They're the ones taking care of the patients. If they're not also buying into this quality improvement thing you have going on, then you're not going to improve the quality in your organization. You're not going to be able to improve the quality care because they're not participating in it. They're the ones who have to do the work, and they're the ones who have to provide the services. So you have to, as an organization, if you're going to focus on quality improvement, you have to get the employees to buy into it. The employees have to believe in it, have to believe in quality improvement, and they need to be very engaged in whatever quality improvement activities you're proposing or you're putting out there and you're enforcing. They have to be engaged, and they really have to participate in that. Okay, so definitions. What does quality mean? So quality is the degree to which the health services for the individuals and the populations increase the likelihood of desired health outcomes and are consistent with the current professional knowledge. Okay, so quality, the degree, how likely or how well is the services for the individuals and the population, all the for the patients, how likely is it to increase the likelihood of the desired outcomes? How likely are these services that your employees are providing for patients, how likely are they to reach the desired health outcomes? Okay, and how likely are they consistent with the current professional knowledge, certain standards of quality that you guys uphold, and all that? Okay, that is quality. The degree to which it, reaches those levels. Okay, then patient safety. This is freedom from accidents or preventable injuries produced by medical care. Okay, that's easy, right? Patient safety. Okay, let's move forward. So, crossing the quality chasm. There are 6 characteristics of a high quality healthcare system. Okay, so these 6 characteristics are: is it safe? Okay, is it effective? Is it patient-centered? Are you focused on the patient with whatever you're doing, the quality of services that you're providing? Is it timely? Okay, is it efficient? Timely usually goes into efficient. Efficiency is more about like the time, the cost, and how likely did you reach your desired outcomes. Okay. So is it efficient? And is it equitable? Is it is everyone being treated equally? Are all your patients able to get that same level of quality, or are you biased? Okay, are there biases? Are some of your employees biased? Are they treating some patients better than others? Okay, so it's equitable. Does everyone have access to this level of quality, the same level of quality that you're giving to everybody else? Okay, so there are key quality issues related to health services. All right, so we have 3 key quality issues. Okay, 3 terms we're going to look at here. First, we have overuse, then we have underuse, and then misuse. Okay, so overuse, this is when, let's say, a physician over prescribes or gives more than what is actually needed, okay, or gives extra, or so let's say a physician, there's a situation where a physician gives a patient a medication or a treatment and there's no medical justification for this. It's just the physician wants to give this extra, or something that is totally not needed. There's no according to whatever standards of quality, there's really no kind of justification for it. It's just the patient's just going to be receiving this. And when there's overuse, there are risks to the patient's safety, of course. Okay, because any time you put something in their body, anytime you do something like that or mess with their body or their health, there are always going to be risks, because of course treatments and drugs and things like that can be invasive. They can be they can have many side effects. They can mix with other things that the patient is taking or doing and not produce desired outcomes at all. So if it's not necessary, if there is no medical justification, then it shouldn't be done, because it's risky. There's risk for medical error there. Okay, so that's overuse, providing things like extra and doing more things that have no medical justification for them. Okay, then we have underuse. Okay, so underuse is when you're not complying with evidence-based guidelines. You're not giving enough. You're not you fail to provide the patients with the medically necessary care that they're supposed to get with their diagnosis. Okay, so you're giving them less than what they should have, like less treatments. Maybe their diagnosis requires a certain treatment according to our evidence-based guidelines, standards of practice, and you're not meeting them there. You're giving them less than that because maybe you're trying to save money. Maybe you're trying to save your energy or whatever. So you give them less. Okay. So I want you guys to kind of think of situations. Okay, think of your own examples of how to use these terms and situations. All right. So this would be a situation where a provider did not provide the patient with what they should have. Okay. Okay, maybe they didn't give them all the medications that you usually prescribe for this particular diagnosis. Maybe they're not giving them the treatment. Maybe there's a certain treatment that they should have, and you're giving them this because you're saving money, or you can make more. Sometimes also what some practitioners do, and this is fraud, this is bad, but maybe a practitioner might bill for a really high level treatment, right? An expensive treatment, and this is probably the treatment that might be required for their diagnosis, but it's expensive. So you're gonna bill the insurance company for this, and you're gonna try to get the money that's up here, right? This large amount of money, and then but what you actually do for the patient is gonna be way less. Okay, so you're probably gonna give them less. You're gonna pocket the extra money, bill for the high thing, give them the low thing, and that patient is just not being taken care of appropriately. Okay, that's underuse. Okay, you failed to provide the patient with medically necessary care according to evidence-based guidelines. Okay. Now, misuse is another one. This is just straight up like medical error, like accidents. Maybe you provided an incorrect diagnosis. Maybe you read something wrong on the paper. Maybe you couldn't read what the physician was writing, the orders that were in the paper, so you did something different, and then you found out later, and that was medical error, but now the patient is suffering because of that. Okay, that's misuse. So a lot of misuse is just accidental, preventative conditions. So things that didn't have to happen, but they did, and it's just you diagnosed them incorrectly, you gave them something that they shouldn't have had, maybe you didn't pay attention to something, maybe you couldn't read something, whatever, but you know, it resulted in something that could have been prevented. Okay. All right, so here we're gonna look at a couple of quality improvement strategies. Okay, so let's move forward on that. Okay, so total quality management. This is a system of management that is based on this principle that every single staff member, every employee, everyone that works for this company has to be absolutely committed to maintaining high standards of work in every aspect of the company's operations. Okay? Every staff member has to be equally committed. All right, so this type of quality management is very customer focused, very customer oriented. They, like I said, they involve the employees like a lot. Every employee has to be committed, right? They're very process-centered thinking. Okay. It's more of an integrated system. This can be, they use more of a strategic and systematic approach. It's like numbers and this and, you know, very, right? And they, this is more of a continuous improvement kind of thing. It's not like, let's have one intervention where we all just sort of get on board and maybe we'll raise our levels to something else and then we'll just be there and we'll just improve ourselves, our standards, and then that's where we'll be from here on out. This is completely focused and always being committed to an improvement thing. So this isn't necessarily just a thing, an intervention that you do. This total quality management is just like, this is how your everyday practices, this is how your company works. You are always continuously improving. Okay. And so, and everything is very systematic here, and they only make decisions based on facts. Okay. And there's, you know, they like to focus on communication and whatnot. Okay, so model for improvement. This is actually the model that most healthcare organizations model their quality improvement strategies and whatnot after. Okay, so the model for improvement provides a framework for developing, testing, and implementing changes that lead to improvement. Okay. It's organized around this plan, do, study, act cycle. So it's just like a never-ending cycle of, you know, plan, do, study, act. So plan, do, study, act. Plan in this situation would be develop and implement the change gradually. So you're just going to plan out how this change has to happen and sort of, you know, implement the change gradually so that it's not like a, you know, so that it like really sets in. When you do things gradually, it helps to it helps getting all the employees on board, because usually people are resistant to change. So when it's more of a gradual effect, then it settles a little bit better. So anyway, and of course in healthcare, you don't want too much friction. Things could go wrong. So anyway, Next, the next step is do. So you implement that change and also collect data for analysis, because of course you need to make sure everything you do, any kind of changes, any kind of strategies that you ever do, interventions, things like that that you do in your organization, you always want to be able to make everything that you do measurable, so you can collect that data and you can reflect on those changes and see if you met your goals, you didn't, where you could improve, things like that. So next step would be to analyze the change and compare the results to the expectations, which is what I just said. So you always want to be able to collect data no matter what you do, so that way you can analyze your change. Okay, you can see where you are now, where you were, and just figure out exactly where you are supposed to be, and if what you've been doing has worked, if you need to implement something new, like that. And then the last step would be to act. And in this way, it's just decide how you're going to move forward. Given your data in the past step, exactly how are you going to move forward? Do you need to continue implementing what you have been doing? Should you reevaluate? Should you create a whole new plan? How should you move forward, right? Okay, so Six Sigma. This is another quality improvement model that can be used. Okay, so the Six Sigma is a highly disciplined and structured framework for delivering an extremely high quality level of product or services. Okay, and Six Sigma has 5 different steps that occur in a precise sequence that is used for understanding and improving any process. Okay, so the 6 steps. First, it's to define the process improvement goals consistent with customer demands and organizational strategies. Okay, then next, you want to measure the current process, which you're currently doing, and develop a baseline for future comparison. Okay, because like I said, remember, you always want to make sure that you are able to measure everything that you do. So right now you're going to kind of develop like your control, okay, if you will. Then number 3, you're going to analyze the process to identify all the relevant factors and verify cause and effect relations, as well as identify the root cause of unacceptable variation. Okay. Then, number 4, improve or optimize the process. Okay, so depending on what you figured out in step 3, okay, you can kind of figure out if you need to move forward or if you need to keep things going the way that they are. Number 5, control the process to sustain future gains. Okay, and another thing that I want to say about Six Sigma, they tend to do this thing for those that have like for Six Sigma, this is basically the whole process of quality improvement. Now, when you do this, when you have you adopt this level or this quality improvement model, another thing that you should be aware of is that Six Sigma also tends to have different levels, okay? Different levels of authority as you move through this quality improvement model. So as you move through your certification and training and things like that, and each different levels are characterized by different belts, kind of like in karate. So you know how in karate or martial arts you can get different belts when you can earn different colored belts, and as you move up and you learn more of the martial arts style. Same thing here with Six Sigma. So it's as you move up through the whole quality improvement model, and you move up in the rankings of leadership in this model, you earn different levels of belts. Okay? All right, so lean. Lean is this one is totally focused on customer service. Okay, so if you have a very customer service oriented type of a business, Lean may be the right quality improvement model for you. Okay, so this likes to emphasize customer service, also waste reduction. A huge thing about Lean is that they're very, very simple, and they just want to carve and cut things out that have nothing to do with customer service. Okay, so there are a couple different aspects of Lean. So first, let's look at value stream. First of all, you want to identify all steps in the value stream and eliminate the steps that do not create value for the customer. See, again, customer service oriented. So as you go through and figure out everything that you offer, or everything that your employees are doing and to provide value for customers, you want to go ahead and just carve out things that have nothing to do with providing value for the customer. Okay, then flow. You want to ensure that value creating steps occur in the right sequence, in the right order. Okay, as you're building your quality improvement strategy. Then pull. Ensure that the work occurs in response to customer demand. There we go, very customer service oriented, given whatever the customers demand, whatever they wish. Your organization should focus on the customer, so figure out exactly what they are demanding, what they want, and that is how you're going to sort of figure out what your work is going to be, the different things that you need to do or you need to change in response to what the customer is demanding. Then the perfection level. So then at this point, you just sort of repeat all your different steps. Okay. So some important themes in all quality improvement models are the fact that they all emphasize the importance of planning. Okay. So you probably saw in each one of those different models, planning is probably like the first step. You have to figure out where you are and you need to plan out how you're going to get to your goals. So planning, very important. Also organizing and coordinating your quality improvement efforts. Okay, they have to be well coordinated and organized. That's why you have different quality improvement models. So you can model your specific quality improvement change that you need to do specifically for your organization. Okay, and then sustaining change is a huge one. Each one of those, if you caught that, once you get to the very end, you don't really stop there. You evaluate yourself, you evaluate the situation, and you go back to the very beginning and continue the change, because you're always trying to improve the quality that your organization provides. Okay, and next, meaningful and valid measures. And I think you kind of noticed that in every step of every single one of those different quality improvement models, you always have to measure everything. Everything that you do should be measurable. Okay, so you should have you should have meaningful, valid measures that actually can tell you something about what is going on. If you're doing something that is actually improving the quality, or if what your efforts aren't even working, you're not getting anywhere with that. So measurements are very important. Okay, and also the participation of the appropriate individuals, which would most likely be, of course, that's really everyone in the organization, but everyone sort of plays their role. Management will play their role to enforce certain things and develop these strategies, and then the employees need to participate in their roles in upholding all these different changes. Okay, so that's kind of how it works. Anyway, so this is pretty much the end of the quarter, the rest of everything that you need to know for this course. I hope that you enjoyed this last video and learned a lot, but if not, if you have any questions, please let me know and go ahead and ask them in the comments or an email or anything like that. Good luck with everything, and I will see you guys soon. That's it. See you.